Welcome to our deep dive into anismus, a often misunderstood condition affecting the digestive system. In this video, we'll explore what anismus is, its causes, symptoms, diagnosis, and the various treatment options available. Join us as we unravel the complexities of this anorectal disorder. So, what exactly causes anismus? The exact etiology isn't fully understood, but it's generally believed to be a result of learned dysfunctional habits or a discoordination of muscles involved in defecation. This can stem from chronic constipation, infrequent bowel movements, straining during defecation, or even a psychological component, like fear of pain during bowel movements. In some cases, underlying neurological or muscular disorders may also play a role. Let's delve into the pathophysiology. Normally, defecation involves a coordinated effort. The rectum fills with stool, triggering the urge to defecate. The puborectalis muscle, which wraps around the rectum, should relax, and the anal sphincter should open, allowing for the passage of stool. In anismus, however, the puborectalis muscle paradoxically contracts or fails to relax properly during attempted defecation. This creates an obstruction, making it difficult or impossible to evacuate the bowels effectively. The pelvic floor muscles can also contract abnormally, contributing to the problem. This discoordination disrupts the normal defecation process, leading to straining, incomplete evacuation, and other associated symptoms. While precise epidemiological data is limited, anismus is estimated to affect a significant portion of individuals experiencing chronic constipation and other defecatory disorders. It's believed to be more prevalent in women than men, and it can occur at any age, although it's more commonly diagnosed in adults. It's important to note that anismus is often underdiagnosed, as many individuals may be hesitant to discuss their bowel habits with a healthcare professional. The signs and symptoms of anismus can be quite varied, significantly impacting an individual's quality of life. Common symptoms include chronic constipation, straining during bowel movements, a feeling of incomplete evacuation even after spending time on the toilet, pain or discomfort in the rectum or anus, frequent urges to defecate without success, and the need for manual maneuvers, such as using fingers to assist with stool evacuation. Some individuals may also experience bloating, abdominal discomfort, and a general feeling of being blocked up. Diagnosing anismus requires a comprehensive evaluation. The diagnostic process typically begins with a thorough medical history and physical examination, including a digital rectal exam. Further investigations may include an erectal manometry, a test that measures the pressures within the rectum and anal canal during simulated defecation. This test helps to identify abnormal muscle contractions and discoordination. Balloon expulsion test, where the patient tries to expel a water-filled balloon from the rectum, can also be performed. In some cases, imaging studies, such as defecography or MRI, may be used to visualize the pelvic floor muscles and rectum during defecation. Anismus doesn't typically have rigid classifications, but it can be broadly categorized based on the predominant muscle dysfunction observed. Some individuals may primarily exhibit paradoxical contraction of the puborectalis muscle, while others may experience pelvic floor dyssynergia, involving uncoordinated contraction of multiple pelvic floor muscles. The specific type of dysfunction can influence the treatment approach. The treatment of anismus aims to retrain the muscles involved in defecation and restore normal bowel function. Biofeedback therapy is a cornerstone of treatment, helping individuals learn to relax the puborectalis muscle and coordinate their pelvic floor muscles during defecation. This involves using sensors to provide real-time feedback on muscle activity. Other treatment options include lifestyle modifications, such as increasing fiber intake, staying hydrated, and adopting a regular bowel routine. Stool softeners or laxatives may be used on a temporary basis to alleviate constipation. In rare cases, surgery may be considered, but it's generally reserved for individuals who haven't responded to other treatments. While completely preventing anismus may not always be possible, several strategies can help reduce the risk. Maintaining a healthy lifestyle, including a balanced diet rich in fiber, adequate hydration, and regular physical activity, is crucial. Establishing a regular bowel routine and avoiding prolonged straining during defecation can also be beneficial. Addressing any underlying psychological issues, such as anxiety or fear related to bowel movements, may also play a role in prevention. The prognosis for individuals with anismus is generally good with appropriate treatment. Biofeedback therapy is often highly effective in retraining the muscles and restoring normal bowel function. However, it's important to note that treatment may require patience and persistence. Recent research has focused on refining biofeedback techniques and exploring the role of other therapies, such as neuromodulation, in the management of anismus. Studies are also investigating the potential benefits of incorporating psychological interventions, such as cognitive behavioral therapy, into the treatment approach to address any underlying emotional or behavioral factors contributing to the condition.